Welcome to Adapt NCLEX. This is a series on maternity nursing NCLEX review. We're dealing with concepts that you will see in a nursing school and on the NCLEX using NCLEX practice question with detailed rationale test-taking strategy. Stick around. Let me review concept with 10 high-yield NCLEX practice question. Let's get to it. First question, what is the nurse priority assessment following the procedure? A nurse is caring for a client who is in active labor and has just undergone an amniotomy. Test-taking strategy. In every question, we'll be talking about test-taking strategy. What do? Don't even look at the answer choice. Figure out what is going on with the question. It said a nurse is caring for a client who is in active labor and just had amniotomy. What is the problem? Amniotomy is if you cannot spontaneously rupture your memory, the doctor will do it for you. So the doctor basically broke your water, broke the memory, and the amniotic fluid came out. What is your nurse priority action? This is the same as somebody who has spontaneous rupture of memory. What do you think should be your priority in this situation? Remember, the amniotic fluid surrounds the baby floats in it. Whenever amniotic fluid comes out, there's one thing you should do. You should check for what? That's the answer choice. That's the key concept. That's the concept you have to use to answer the question. Therefore, what? Assess for client pain level, monitor maternal vital signs, check the fetal heart rate, evaluate the color of the amniotic fluid. The concept here is what? Every time you see amniotic fluid comes out or there's somebody's water broke, there's a risk of loss of amniotic fluid. In the process, you're going to have cord prolapse. So whenever there's a rupture of the memory, look for cord prolapse. If there is a cord prolapse, baby is going to show signs of bradycardia, which is deceleration. Therefore, what do you need to check? You know the answer, popping out like a candy based on the concept you have used. Therefore, assessing the client's pain, they're not supposed to have too much pain. They just have small discomfort, but no pain. Of course, we're going to monitor their vitals, but that is the most important. The most important, the one who is going to suffer is the kid. Of course, I got to look at the color of the amniotic fluid. If it looks green and if there's meconium in it. But I have to look for, number one is cord prolapse. Therefore, first question down, and the answer choice is what? Number 3. Priority assessment after amniotic fluid amniotomy is fetal heart rate assessment to determine or detect umbilical cord prolapse or fetal distress. Therefore, 3 is the best answer. We're going to use the same strategy. Each question we've got to talk about concept and use critical thinking to find the answer choice in this maternity nursing NCLEX review practice test number 5. Number 2, during a prenatal class for Premi-gravidaria, that means first pregnancy, a client at 38 weeks asks when she should go to the hospital. What is the question is asking? When is the first time to go to the hospital to know if you're in labor so that you can go deliver if this is your first pregnancy? Which response by the nurse is the most appropriate? Same thing. Underline the buzzword. The buzzword is most appropriate. 38 weeks. When can I go to the hospital? That's all. What do you think? Think about it. When contraction occurs like a true labor, when contractions are irregular and mild, when you feel the baby move less, when your memory rupture, and if you are not contracting, even if you're not contracting, think about, look at each answer choice. Stop the video, put down your answer. Let me know. You got it. You can use the information we talk about in first question to answer this question. What are you going to tell a patient who asks you, when am I ready to come to the hospital? Because probably I'm going to deliver. This is a first pregnancy. The key, the buzzword, the concept is what? If you have regular contraction or if you rupture your memory. If you rupture your memory, there's going to be what? Risk for cord prolapse and infection. you need somebody to check it. Secondly, we got to make sure you are in true labor, but you don't know it. You can't tell a patient that you are in true labor. She has no clue the definition of true labor. These words belong to the nurse and the doctors. She doesn't know that. What she will know is when the contraction is regular. But this one I say irregular. So if you have been contraction every 5 minutes within an hour, then you are in what? True labor. You should come to the hospital. Feeling the baby move less is not evidence of labor to come to the hospital. Therefore, the right answer is if your memory rupture, even if you're not contracting, because of the risks of what? Cord prolapse and infection, you should come to the hospital. Therefore, number 4 is the right answer. And that is the concept for this particular question. Clients should come to the hospital when contraction are regular every 5 minutes for the first hour, right? That is the key because it's a regular contraction. And if memory rupture due to the risk of infection and cord prolapse, therefore, is the right answer, is the best answer, and is the most appropriate response from the nurse. During labor and delivery, the nurse performs Leopold maneuver. This is a concept. These videos are concept. Like I said, if you don't know them, write them down. But I'm going to make a bunch of them. This is number 5. It's a concept you need to know. And they are easy information you see in the question. When you know it, answer pop up like a candy. All you need to know, what is Leopold maneuver? At this stage, you should understand what is Leopold maneuver. If you don't know, this is the concept. The purpose of this assessment is to what? Cervical dilation and effacement. Determine fetal position and presentation. Assess maternal pelvic adequacy. Estimate fetal weight based on what? Fundal height. Leopold maneuver. Look at the answer choice. Some of them does not make sense. When you evaluate cervical dilation effacement, you don't do any maneuver. You just use your finger, examine, and then do a vaginal exam. That's all. But to determine fetal position and presentation, it looks like you got to do some maneuver to be able to know where the baby is. I'm using test-taking strategy, critical thinking. Assess maternal pelvic adequacy. It's a pelvic exams, right? Estimate fetal weight based on fundal height. Well, you got to weigh the mommy, right? And you got to weigh, you have to do a bunch of subtraction. I don't think there is going to be any maneuver. You know the pre-pregnancy weight, and then you weigh the mommy, what is the weight right now. You can subtract it, and you can figure out the difference, what the baby is giving to the mommy. Therefore, Leopold is designed to check for position and presentation. They are used to palpate the abdomen to determine the fetal lie, right? Their position and presentation before and during labor, so that we know where the baby head is and everything, so that we can rotate them into a vertex position. Therefore, number 2 is the right answer. You see how you approach question, test-taking strategy. This is how you master them. And next is monitoring a client in active labor, right? The fetal heart rate decreased to what? 80 beats per minute during contraction. What is the next first action? Prioritization 101. You got to be sharp. Is there breathing, electrolyte shock, sepsis, airway, a neurological problem? Of course, yes. Bradycardia. What do you think? The baby has bradycardia. That is deceleration. Bad problem. This shows that's the placenta problem or blood flow problem. You don't know. Do you document the finding? Baby has bradycardia. Do you reposition the client? It can be any position, left lateral or knee to chest. Increase the IV pitocin. It's going to cause more contraction. Baby heart rate drop with contraction. Therefore, do you want to do that? Notify the provider immediately. Can you do something else before you call the doctor? Test-taking strategy. I know you know it. Adapt and NCLEX way. What do you think? This baby is not doing well. The best thing is to ensure blood flow, whether knee to chest or left lateral position, do it. But the most important is mostly placenta deficiency. Therefore, what is the problem? We need to place mommy on the left lateral position. This will allow blood flow and the baby will do fine. So the first action is changing position, mostly on the left side. That's the right answer. Number 5, when a fetus is in the vertex position, the nurse should listen for the fetal heart tone at which location. Like I said, this maternity series is about concept. Well, you got to write this down. How can I find the baby position if they're presenting in the vertex position, or if they're presenting in what? Bridge position. These concepts, you have to know it. And this is one of them, how to answer that. And this question answered that question. Baby is in vertex. That means this is the mother. Baby and umbilicus is here. Baby head is here, like that. The baby head has to be down. Baby may be laying down. It can be any position. So far as it's like that, baby head is way down here, like that. Therefore, it's 99% below the umbilicus. The baby can lay down like that and still will be what? Below the umbilicus. If the baby is breached, that means his head will be on top like that. It's above the umbilicus. So the concept is in vertex position, the head of the baby is below the umbilicus. Therefore, if the head is below the umbilicus, this is the baby head, I can listen to the heart sound here or here. Therefore, not above the umbilicus, in the upper right upper quadrant of the abdomen. That will require what? A transverse lay, right? Below the mother's umbilicus, yes, it's below it. It can be left or right. Midline and the fundus, you don't check it. So the best position is usually either left or right and below the umbilicus, because the baby is in the vertex position. With the vertex position, the fetal heart tone are best set in the lower quadrant of the maternal abdomen. So 3 is the right answer. Which response is most appropriate? This question can be hard. It's not hard. It's based on language, words the NCLEX will put on, and certain words you should avoid when you're picking an answer choice. That is the strategy here and the concept. A client with what? Type 1 diabetes. Boom, ask the OB nurse which method of contraception is best. She has diabetes and she want to know which method of contraception is best. The key word is what? Diabetes. What do you know about diabetes patient? And she want to know which contraception is best. The concept here is what? Stop the video. I want you to try this question. And then when you finished, begin listening to me. 10 seconds. I know you got it. Did you put down the answer? Yeah, you got it. I know the answer you choose because you watch Adapting. What is the right answer? And what is the concept? Diabetes patients are most likely to get cardiovascular complication. They have cardiovascular complication already. Therefore, you should not give them any contraception that will cause more cardiovascular complication, like any hormonal medication that contain estrogen. And that is all the key word to use. Therefore, IUD is okay, but look at it. This is the bad word. Safest. Never pick an answer choice in the NCLEX that is totally 100% talking about the best, right? Safest method. Barrier method, yeah, is good. It is not hormonal, but he said it's the best choice where there's other choices. Hormonal method, yes, we should avoid it. And what do you say? Increase your risk of what? Vascular complication. Sterilization is the, look at the word, only safe method for you. So which one would you choose? Which one would you choose? This is number 6. It's a little bit difficult, but that's what it's designed. But I'm trying to teach you certain things when you're picking an answer choice. There's taking strategy. IUD is good, but it's not the safest. The word safest changes the answer choice. It's too absolute. Barrier method, you put the word best. It's too absolute. Hormonal method, yeah, it increases the risk of vascular complication. It does not say anything, it's just telling you the fact. Sterilization is not the only safest method. And therefore, the right answer is number 3. But that's the concept I want you to know when you're picking answer choice. Clients with diabetes are at increased risk of what? Cardiovascular and vascular complication. Therefore, barrier method and IUD are preferred, but none of them is the best, right? None of them is the safest. They are okay, 100% the same. Second one, too, is this. When you're picking an answer choice in the NCLEX regarding oral contraception, always think about estrogen. They're more likely to cause clot. Therefore, safer method is to use progesterone only one, or barrier method, or IUD. You should not pick an answer choice that's the safest, the only safe method, the best. No, that one make you wrong. 7. This is also content. It was in the previous video, but I expanded. In which situation would administration of Rhogam be indicated? You have to know situation when we give Rhogam. Select or apply. At 28 weeks of pregnancy with what? RH negative mother. After delivery of what? RH positive baby. After amniocentesis. When the mother is RH positive and give birth to RH negative. After abdominal trauma during pregnancy. If you confusing, don't worry. Ignore it. Ignore the answers. Go to your content. Take your content. It said administration, Rhogam, the safest, indication. What is the problem? It happened when mommy is what? RH negative. And he gave birth to what? RH positive. Right? So that's the key information. If you don't know anything at all, mommy give birth to RH negative and the baby is RH positive. That means the mommy will be what? Synthesized with that problem. Therefore, we got to protect the mommy. And therefore, if you are RH negative at 28 weeks, we don't want you to get antibodies, so we give it to you. It's given at 28 weeks. If you deliver RH positive baby, we have to give it to you. If you have amniocentesis, we are exposing the baby blood onto you. We're going to give it to you as a precaution. When you are RH positive, I don't worry about you anymore. It does not matter whether your baby is RH negative or positive, because you're already RH positive, I'm good. And you involve in accident, you're going to get it. So those are the situations I want you to know. Indication for Rhogam. Rhogam is indicated for any situation where there's blood mixing that occur between the mother and the baby, where the mother has what? RH negative, right? And not indicated if the mommy is RH positive. So that's the key. So 1 is right, 3 is right, 5 is right, and then 2 is right. 4 is wrong. Which finding will require the nurse to intervene? This is another concept. What is the concept? A nurse is assessing the postpartum client 3 days after delivery. Which finding will require the nurse to intervene? And you can see the answer. She's talking about the uterus. After delivery, the uterus is supposed to go down. It goes down, what? 1 centimeter every day. So if this is the umbilicus, after delivery, the uterus is slightly above the umbilicus. By 12 hours, it's supposed to keep on going down. It goes down 1 centimeter every day, 1 centimeter every day. It keep on going down 1 centimeter. So after 3 days, it should have gone down 3 centimeter below the what? The umbilicus. And that's your right answer. Uterus is located 3 centimeter below the umbilicus. You don't need to what? Intervene. Uterus is firm and midline. You don't need to intervene. We want it to be contracted and in the middle. If it's boggy and it displays, we have a problem. Uterus is palpated above the umbilicus. 3 days, you stay boggy. If you're above the umbilicus, you're going to bleed. Uterus descend 1 centimeter per day. That is the requirement. Therefore, which one require intervention? What do you think? Number 3. You see the strategy. That's the concept I'm using to answer the question. Day 3, postpartum, the uterus should be involuting and descending. The fundus above the umbilicus may indicate uterine atony and retain fragment requiring intervention. This is the content. Like I answer the question and I give you the content associated with it. That is why it's maternity nursing, NCLEX review, NCLEX practice question, test taking strategy using expert review to answer this question. And you take note regarding this information. Number 9, a client at 6 weeks gestation is taking levothyroxine. Which station should the nurse provide? What is the content here? If you have hypothyroid and you're taking Synthroid or levothyroxine and you're pregnant, you got to teach the patient. Don't stop the medication. Continue taking the medication. You may probably need a double dose, but you should not do it on your own until the doctor tells you to do that because of the immunosuppression. But you have to give them information about safe medication administration. You should stop taking this medication until after pregnancy. No, it's going to get worse. Take the medication on empty stomach, separate from your prenatal vitamins. Yeah, you should take it with a full glass of water and remain upright for 30 minutes. This medication is unsafe in pregnancy and should be changed. It's safe in pregnancy. You can still take it. You should double the dose during pregnancy for best results. You should not double the dose in certain situation. If you get sick, yeah, but the doctor is in charge. What you need to do, take the medication on an empty stomach, separate from your vitamins. That's the concept. Levothyroxine is safe, necessary during pregnancy. It should be taken on empty stomach and separate from what? Any vitamins that you take. No iron, no calcium supplement, right? And the last question. A client who is 12 weeks pregnant is newly diagnosed with grave disease, hyperthyroidism. Which treatment is indicated? This is pharmacology. I want you to, endocrine pharmacology, in addition to maternal pharmacology in the patient who is pregnant and is diagnosed with what? Grave disease. But this question requires critical thinking. I want you to try it and think about the answer and put down in your answer and let me know what you think. Then listen to me. It's a test taking strategy. A client who is 12 weeks pregnant is newly diagnosed with grave disease. Which treatment is indicated? Levothyroxine, radioactive iodine therapy, PTU, and methimazole. Stop the video, answer it, and let me know what you pick. The content is what? Grave disease, you have too much thyroid hormone. We got to slow you down. Which medication you're going to use? Number 1, think about it. Levothyroxine is thyroid hormone. Patient already have too much thyroid hormone. Why do you want to give them another thyroid hormone? Wrong answer. Patient is pregnant. They cannot take any radioactive iodine therapy because they're pregnant. Therefore, you're left with 3 and 4. This is the content, endocrine content. You have to know this because if you see a question and they give you a pregnant lady, you have to be careful. In the first trimester, PTU, proprietary uracil, is the one that is burst, that put the thyroid hormone down, that you can use for grave disease. After the first trimester, methimazole is the safest. Both of them can be used to treat hyperthyroidism, but PTU is the best in the first trimester. And after that trimester, second, third trimester, you can use methimazole. This is Adapting Class. 10 questions, maternity nursing, NCLEX review, NCLEX practice question, test taking strategy. This is what you need to pass your NCLEX or make nursing school easy. Watch the series, and if you like, put the comment down. Let me know what you think. And subscribe to Adapting NCLEX or join our membership. Take care of yourself and bye.